Today we're going over coaching and progressing the chin tuck and the chin tuck head lift for physical therapists. So chin tucks and chin tuck head lifts are very evidence-based exercises for people that have neck pain. I think the big issue with them is that we typically give folks, let's say, chin tuck, maybe a chin tuck with a head lift, and that's the end of their rehab, right? Which may be pretty good for the average folk, but if someone is trying to get back to higher level sport, I'd like to try to advance this a bit. So I'm going to show you how we coach it and also how we advance things, alrighty? Ready to get rolling? Okay. So the first thing I like to do, and you can use Chattanooga blood pressure cuff if you like. This was studied by Gwen Joel, but I just use the towel to start, right? So first thing we do is we get a towel roll. You want to make sure it's not too big, because if it's too big, it's going to change the exercise up in a way that's bad. So let's have you lift up your head and put this right underneath, okay? And if you're noticing that your roll is making someone's neck do this, it's a little bit too big, all right? The other piece is that some folks have a pretty big thoracic kyphosis, and that's the case. They're going to be sitting like this naturally, and you can take something and just bolster behind their head like this. Lift up just a touch and come right back down again. So good, and then relax. And so Chris doesn't need this because he has pretty good posture here. He doesn't have a big thoracic kyphosis. So the first thing I coach my patients to do is let's take your left hand and just put it on the front of your neck here. I'm going to take my right hand and put it on the front of the neck here, and I'm right on the SCM. So if we're looking at the muscles we're at, you can see it sticking out to the side. The first thing I'm going to ask you to do is try to squish this towel without engaging these muscles here, okay? Very good. Another cue I like is pretend like you have a stinky sock and you're putting it towards your patient's face, and they're trying to tuck away from that. So give me a couple more reps just like this. Very good. Now usually I coach people through a set of 10 or so, 1 second pause in the full tuck position. Make sure it's not bringing on a bunch of pain, all right? So once people are tolerating this really well, we want to advance it. The next exercise to do that is going to be a chin tuck with a head lift. And it's pretty much the same exact motion. The only thing we're going to do is lift up the head. Now when you do a chin tuck with a head lift, the front of the neck is going to be active, okay? And that's fine. That's not a problem. If you're trying to keep the neck, keep it from firing in the middle of the exercise, that's kind of like asking someone to keep their bicep relaxed while they're doing a bicep curl. It's just not going to happen, all right? So let's go ahead and tuck into this towel right here and then lift up just 1 inch. Very good. Let's do 3 repetitions. So one of the coaching cues for this is we want to make sure we're not kissing the ceiling, okay? So show me a few bad repetitions where you're trying to reach your lips up to the ceiling. Yep, so that's the position we're not trying to reinforce. What we'd like to do is make sure the chin stays tucked in and just 1 inch up. The other thing you'll find is some folks like to bring their head way up, so show me a couple bad reps that way. Yep, right back down. And to be honest, it's not a bad exercise, it's just not the chin tuck head lift right, at that point, right? That making sense? Okay, so one of the issues with this exercise is oftentimes I feel like it's just too easy, all right? So if you're dealing with, like, let's say a contact athlete or Olympic weightlifter or something that needs a little bit more strength, we just add some weight. So I have a dumbbell wrapped up in a towel here, and what we're going to do is put this on Chris's forehead here. Let's have you hold that with your right side hand. Normally you hold it with 2 hands, all right, but you want to, just for demonstration purposes. So first and foremost, give me a chin tuck and just lift up 1 inch and then right back down again. So you can see automatically there's a little bit more shaking. This is obviously a tougher exercise at this point for Chris, and I would say it's a good place to start if he was dealing with a bunch of neck pain. All right, and take a breather. And obviously we can use heavy dumbbells or light dumbbells, so there's a lot of possibility for loading here. The other way I like to advance neck exercises is by making them a little bit more functional. And the first exercise I like to use is going to be a dead bug variation. So let's have you bring your arms and legs up in the air. Good. So you can do this in 2 ways. We can do a rep at a time, so you do chin tuck, and then a head lift, and then you do 1 dead bug and come back together and rest the head, or you can keep the head up the entire time. Just keep in mind, keeping up the entire time is pretty dang hard, right? So oftentimes you're not going to be limited by the core, you're going to be limited by the neck, so just keep that in mind. So give me a chin tuck with a head lift, all right? Maintain this position as I give me a dead bug. Good. Come all the way back. Now rest the head. Okay. So the second set, let's try a few repetitions maintaining that head position. You ready? Chin tuck, head lift, and then go for it. Good. What's nice about this is we're starting to get a little bit of a core, and we're also getting a lot more endurance for the neck. So it's not just 1 repetition at a time, it's multiple, which is kind of similar to the neck's normal function every day. It has to be able to hold itself in place for a long period of time. How's that feel?
Good.
Nice. Okay, very good. The next way I like to advance some of the neck exercises is to make it a little more functional with the shoulder, right? So in folks that have neck pain, a good way to treat those folks is to work on the deep neck flexors, but also some of the muscles around the shoulder blade, namely serratus anterior. So we're going to incorporate a press, which has high EMG of serratus, with the head tuck or chin tuck head lift, all right? So go ahead and grab this here. We're going to set up like we're doing a Turkish get up. So this leg is straight, This is up. We come out to the side a little bit. This is better done on the floor. I'm just going to demonstrate on the table. So what we're going to try to do is press, drive with your right side leg as you do that, chin tuck head lift, and at the top, hold the chin tuck head lift for a second, then come right back down the way you started. You ready? Okay, go ahead. Yep, press her up. Good, and then right back down again. Give me a little more roll. Go ahead and press, reach. Good, and when you finish this press, make it right over your shoulder. Go ahead and press, reach, just like that, and then right back down again. So you can see that the neck is very active. The deep neck flexor is going to be working. The musculature on the front side of the neck is working. The musculature probably on the side of the neck is working. We're also getting a little bit of core, getting a little bit of work for the hip on this right side, and we're getting a lot of serratus right here. And if this is getting easier over the course of time, you can turn this into an entire Turkish get-up. So that sound good? Yeah. Alrighty. Thank you, Chris. So the learning is not over. If you guys want to learn more on how to be a better physical therapist and work with your patients, get them out of pain and back in the gym, click on this link that's right here. Thank you.